Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you've tuned in for another episode of my live chat discussions ahead of our new premiere for a brand new video. Welcome everybody. If you're new to the channel, I'm Dr. Khaled Sadek, and I specialize in the removal of cysts and lipomas, and I've dedicated my entire channel to that particular topic. So if you see anything in the videos and you would like treatment, then don't forget to contact me at lipomacyst.com. That's your one-stop shop for all medical needs, particularly cysts and lipomas. Every Wednesday, Friday and Sunday at the same time, 9:30 GMT time, we do a live chat discussion around the world for all of our audience. We've been doing this over the COVID period, trying to keep morale up, as well as producing videos 3 times a week, some fantastic pops that just keep popping out at you. The structure of the chat, as you all know, is a brief introduction where we're then following up our last video, our forthcoming video, some questions from the floor, and a big shout out to everybody who has joined in. So I think it's fair to say we all enjoyed the last video, an infected cyst on a twin cam production. It looked pretty tense. Let me know what you thought. I mean, the skin was absolutely tight. I mean, if you'd left it any longer, it would have ruptured, and we've had to have packed it, and the process would have just dragged out for weeks and weeks and weeks. So if you do have a little cyst in your skin, get it removed straight away. In the next clip, the lady has done just that. She's come to see me. It's a pea-shaped size cyst, and she's taken it out. In fact, let me know if you think it's a cyst or a blackhead. We've put a still on the Instagram and Facebook pages, so if you haven't checked those out, check those out. I'm sure you've all already checked it out. So comment down below. Let me know what your thoughts are. Is it a blackhead? Is it a cyst? If you've seen the pictures, put it in the comment. Let me know. Yeah, so I think everybody absolutely enjoyed the last clip. It was a lot of content. The lady was clearly very, very uncomfortable, but a wonderful result. We managed to get part of the sac out and corrected the rest of it. I try now to avoid packing. A lot of people asked about packing. Now the process about packing is it takes several weeks and it needs to be changed every 24, 48 hours. And what you're doing is letting the body heal by what we in medicine call secondary intention. This top-down primary intention heals much, much quicker. But if you leave something to heal from the bottom, it takes infinitely longer, and the scarring is a lot worse. So where possible, we washed it out with some disinfectant, we curetted it, we took out as much of that necrotic tissue, we gave her some antibiotics to go home with, and she did fantastically well. So great result there. A lot of gunge came out, and let me know if you like that kind of stuff. We had one a couple of months back, the Oxford cyst, which was also really, really gooey. If you haven't seen that video, check out the Oxford cyst. I think it was back in March. I want to say March, springtime. Now she's probably last year, autumn or something. Anyway, check that out. So in the next clip, in fact, we've got 2 cysts in the next clip. 2 for the price of 1. So we've got a blackhead, a little unicorn blackhead, and we've got a punch biopsy. So we don't tend to show that many punch biopsies because, you know, you guys want to see the really exciting stuff. So I thought it'd be a good opportunity to put the punch biopsy with a blackhead. That way you get to see everything. So make sure when you see the next video, make sure you watch it to the very end, because you'll see the punch biopsy. And it really is kind of this circular apple core, about 6 millimeters in diameter, surgical blade. And it just goes into the skin, cuts through the epidermis layer, takes it out. You take out the cyst sac in its entirety, and then you close it up. The only issue with punch biopsies is that you do have this mass defect. You take out a bit of skin, which means that you have to then pull the skin to cover the missing part, and that produces a lot of tension on the skin. And what you tend to find is that these pop open and it produces a pink scar. So I'm not a big fan of punch biopsies, only where necessary. So dermatofibromas are a very common skin complaint. Typically after shaving, the hair's kind of grown in over time. It's a chronic infection, and that does need a punch biopsy. By the way, if you're watching, you haven't pressed the like button. I know 40 of you haven't. Press that like button. So the punch biopsy we do for the dermatofibromas, again, I really don't like it because the skin does pop open and it produces this like hypopigmented fleshy part on the skin, while if you do a direct incision, then it doesn't have that same effect. I was also invited on a television show, a roundtable discussion discussing crystal meth. bit random. So let me know what fiction, and we're discussing crystal meth. There we go. Here in England, we were reducing the lockdown for coronavirus, but unfortunately, today the Prime Minister Boris Johnson came on national television with the Chief Medical Officer, Professor Chris Whitty, and they said we have to slow down the easing. So corona numbers are actually rising. They jumped from 3,000 to 4,000 in 24 hours. So that's a whopping 30% in 24 hours. So now certain areas of the United Kingdom are in lockdown, particularly up north. Different households are not allowed to mix. And masks are now being compulsory everywhere. Ice rinks, bowling alleys, they're not going to be open for some time. Neither are concert halls or gigs. So further restrictions being placed on the British people. If you're in a country that's really badly hit, remember, stay safe. We've listened to what you've wanted to we've listened to what you've said about the mask merchandise, and hopefully by the weekend you can get your own. You can get a Dr. Britpop a Corona mask on the Teespring. If you type in the Teespring, you can get that as well. Remember, all proceeds go to charity, so that's a really good cause for cancer research. So let's take some questions. I remember last time I think we had shingles and herpes. Let's see what questions we've got today. Ask anything you like, and I'll do a big shout out. Let's scroll up to the top. Let's see who hit in on the podium. So right at the top, Gail Marie Reynolds. She's at number 1. Wow, she's waiting for the show. She got in at pole position. Close on her tail was Bridget Schumacher. She got in at 2nd position, and Marion Beanie came in at 3rd. Wonderful, great to see Scotland being on target there. Unfortunately, I've been admitted to the hospital. Marion, tell me what's wrong. Tell me, please. Let me know. You hope you're well. Let's scroll down. Alessandra Testa from Sao Paulo. She is in town as well. Welcome. Lisa, how are you doing? Jan Turka. Looking like the lifeboat is falling. Oh yeah, well spotted. I'm going to have to fix that. Well, there we go. Well spotted. Okay, Kim Havelone, welcome. Gibby's wife, welcome. Sherry's been doing a grand job. She's been keeping an eye out on people who are infringing our copyright and identifying those who have done, along with Alessandra. And we're going to do copyright infringement on those individuals. So if you see the videos being ripped off another site, let me know. Jane Hall, hi, I have a small lump on the back of my head. It's painful when pushed. It's probably going to be a pile of cysts, Jane. If you're in London or the United Kingdom, drop me a line, I might be able to help. Dr. Sarah from the Smart Invisalign, our resident orthodontist. You think you all know who she is by now? Remember, you can find her on Instagram, Twitter, and Facebook. Her YouTube channel is really kicking off. So if you want to know hacks about dentistry in COVID-19, then you go check out Dr. Sarah. I know a lot of you talk to her and ask her many questions. As the chat goes on, please feel free to do that. That's what we're here for. Rhonda Burke, I'm here. Good afternoon. My favorite doc from Dexter, Georgia, United States of America. Denise Bohonk is from Edmond, and she's hit that like button. Awesome, Denise, the first person to mention that they've hit the like button. That's joining in another 43 individuals with another 30 still to follow suit. Jill Burton, welcome. She's enjoying it. Great to have you back on the live chat there. Tinky Rodenhouse, good evening. Dina is saying, do I ever get blackheads? As in, like, do I personally, or do we get them in clinic? I think I had a cyst here once. I think I squeezed it. Who else? Deborah Little, how are you doing? Sid G says, hi everyone, hope everybody's well. I love how everybody is looking after each other, and that's how the world should be. Spread the love. Joanna Kiewit is saying hi. Ellen Mumford from McHenry, United States, Illinois. Sulalali from London, loving the videos. Awesome. Christiana, that last cyst was on fire. It certainly was. That cyst was super painful. Cole Smith sending a global wave. PE Fitness. Neil and Kirsten loving the live chat. Thank you so much. Let's keep fit. Lisa, hi everybody. Alina Radwan. How are you doing, Alina? What does it say there? Ahlan ya Dr. Khaled. Fantastic. Awesome. We'll come back to that one. It's a foreign language. Alessandra, your pleasure. For Marion Beanie, everybody's sending loads and loads of prayers and wishes to Alessandra there. Tina from the Netherlands, welcome. Gene Stanley from Oklahoma, United States. Rusty is in today in London. 1 day of summer, that's all we're getting. Kim is from Oregon, and it's 106 degrees. It looks like a temperature competition here. Who else we got here? Let's scroll up. Gibby's wife. It sure makes a difference with the twin cams. The different angles together help us see it much, much better. Absolutely. Someone quite rightly said that if it's not my hand in the way, it's the camera in the way, and you just can't win. But with a twin cam, you actually can. I like that. With twin cam, you actually can win. Yeah, so we kind of got the two cameras put in place. I'm in the middle. So if one hand is here, that camera's blocked. So we go with this one and vice versa. And so hopefully that gets you the best views. And you're not going to get the best views unless you hit that like button. There's only 55 likes. Come on, folks. Come on. So Mrs. South, good afternoon from Buffleton. She's waiting for a hurricane that I can't pronounce the name of. Yeah, I heard that there was a hurricane, was it Helena, coming through onto Texas? I know it's hurricane season over in the States. Hope everybody is safe. Dina, under hurricane watch in South Florida. Whereabouts are you? In the Keys, Miami, Fort Lauderdale? Hope everybody is safe in SoFlo. Marty Wojcik, hi from Moreno in California, Moreno Valley, celebrating 75 years on the 29th of July. So unable to join you online. Look, Marty, we're wishing all a happy birthday. Happy birthday, Marty. Fantastic 75 years. Still a young spring chicken. Welcome, Sid G. Who else do we have in the house? Let's scroll up. Cor Smith is saying, hi, Joyce Suggs. Hoping everybody is staying safe. Rhonda Engelauf, Alan, I can't pronounce either. Mesau, stay safe. Let's scroll down. Margarita, how are you doing? Margarita Canales from, I believe, from Portugal. Jane Hall is saying, hi, everybody. Lisa is wishing everybody happy birthday. I love how everybody's just basically jamming in. So, Photo Nom, greetings from Ohio. It's kite flying kind of day. It's keeping us sane. I hope the video is going to help cheer everybody up. Sherry is sharing with us. She's saying that she's got 2 lipomas on the right forearm. She had liposuction on the right. Concerned about lymphedema. Any thoughts? Well, unless you've had undergone any breast surgery, there shouldn't be a huge issue with the lymphedema. It's the question really. The liposuction will cause they will come back, but you know, even if you do cut them out, they may also is involved with cutting it open compared to liposuction. Lisa, did you say gunge? Not familiar with that dermatological term. Yep, we said gunge. Lots of gooey necrotic substance. Sandra Goody, good evening, Dr. Sadek from Enfield, North London. And I think from Sunday, you'll be able to see the face masks, not just on the Teespring website, that's T-E-E, Teespring. You'll also be able to see it on the YouTube page because it has to be kind of verified before they put it on the channel itself. But the face masks are available on the Teespring. So Dr. Khaled Sadek, Teespring. Remember, stay safe, everybody, get yourself a face mask. Kim, belated birthdays to Bardi Shale, Gail Sharp, loves punch biopsies. In fact, this next punch biopsy is really nice because it's really clean. Really sharp surgical blade just goes in and takes that thing out. Denise, unfortunately, my vertigo has reared its ugly head. Well, Denise, remember, if you're suffering from benign paroxysmal vertigo, then the solution is to do Epley's maneuver. Yeah? Those of you who are familiar with Epley's maneuver, you hang off the end of a bed with your head held by somebody, and then you kind of hold it on one side, back to the center, and over to the other, and you got fluid in your inner ear. You got fluid in here, you know, and so that fluid gets stuck, and so it tends to localize the dizziness on the side with the blockage. So there we go, Epley's maneuver. Google it if you need to know more about that. Betty saying hi, Marty's thanking us for the birthday wishes. Sue Polly, hi Doc, and all the fellow poppers and Dr. Sarah. It's thundering and lightning here in northeast Surrey. This feels terrible. Listen, stay safe, keep dry. Sherry is, hello everybody. Melody, Melody. Hope you're having a nice weekend. Be safe, absolutely. You too. Let's scroll up. Let's see any questions. Let's scroll right up. Too many Brits are going to the beach and spreading coronavirus. Yeah, it's true. We've got to be careful. We've got to be sensible. I think you've got to wash your hands. You've got to have your face mask, and you've got to cram in the pub garden. You know, it's not good. So just remember, the Prime Minister has said 3 things. Wash your hands, use a face mask, and keep your distance. It's pretty simple. You break those rules, you're going to break somebody's heart. So, Patty Farling, just saying hello, quick hello, and I absolutely love the last pop you did. Good evening, everybody. Sandra Finn from Ohio. Viv Lee has made it. Awesome. Siji, if scientists develop a vaccine for C19 before flu season, should we still get the flu shot? That's a very good question. So, if they do, yes, you will, because coronavirus is not the influenza virus. So you're going to need vaccination for both of those. If I suspect they're going to manufacture it in time for the rollout, because you don't want to immunize a nation twice. You want to put that corona vaccine into the multi-annual flu vaccine, and then you roll it out. You don't want to be doing it twice, because the logistically is going to be very, very difficult. So hopefully they're going to time it nicely. Jean Stanley, I left my house only 14 times since February because 3 autoimmune diseases. Miss Stanley, please stay safe. Please stay safe. Remember social distancing and shielding. Julie Harrell is saying she's loving the last video and she wants to be my assistant. Kiddo, California, it's mandatory to go wearing a mask in any store. Wow, that's same here in the United Kingdom now, actually. Marion, I need a blood transfusion as my blood count is too low being on dialysis. Oh, Marion, prayers go out to you, darling. Belinda from Cologne. My Dr. K mug has arrived. Belinda, show me. Put it on Instagram, and I'll share it on my account. Let me see what it looks like. Let me know if anyone else has received their mug or pillow. Instagram it to me, and I'll put it on. In fact, we'll put it on the next video as well. Remember, all proceeds go to charity, so it's a good cause. So it's fun and it's a good cause. Rhonda Burke, glad the proceeds go to cancer research. I lost over 20 family members to cancer and currently have 2 in hospice now. Cancer sucks. Thank you for giving. Listen, together we can defeat cancer. All you need to do is just buy a mug. Pretty straightforward, right? It's pretty straightforward. Sue Lalali, I'm glad to receive my mug today. Awesome. So everybody's getting their mugs through the post. Alessandra, I already get the purchase for the mask and the mug. Wow, in southern Brazil. It's very cold and I love studying while drinking tea. Awesome, awesome. So Alessandra has beat us to it. I don't want to spend too much time on them, which my family said looks like a nappy, but I think it looks quite elegant. And there's another one, I think, with birds. But let me know your thoughts. Marisol, Dr. Sadek, in your last video, you mentioned doing this kind of care for 15 years. Was this your first choice as doctor, or did you have something else in mind? That's a good question. I think we'll save that for the next live chat because we've got to go to the premiere. We'll have a quick scroll down. Doc, can you please fix my bad back? So much pain. I think I might have a chat for that. So many people. Let me just have a quick say hello to anyone. Annette, Coroner, Joyce, Susan Burt, Doctor, can you repair flaky, dry skin? Yeah, absolutely. Use some moisturizer. Dr. Sadek, in my opinion, know how to be professional. Wonderful. Look, so many people. Jean is saying hurricane season for the coast, tornado season for us in the Midwest. That's a good point. Princess Zam, love the bad backs. Right, everybody, no further delay. We've got 2 pops. One, is it a blackhead? Is it not a blackhead? And the second one is a punch biopsy. Remember to catch me live on Sunday at 9:30 p.m. and Wednesday 9:30 p.m. and Friday 9:30 p.m. Remember to find me on Instagram, Twitter, and Facebook. And if you need a mask, go to Teespring. Till next time, take care. Bye-bye.